can win with government alone without incorporating the rest of society. It requires a collective approach of both government and the entire society. Since this disease struck our country a little over 2 months ago, all of us have been affected either directly or indirectly. Our day-to-day activities have been affected, jobs have been lost, and livelihoods disrupted. We are aware that it has not been easy for all of us, and as a government, we have been concerned and have introduced interventions to alleviate the sufferings of our people and measures to limit the spread of this virus. You do recall that our initial responses were aimed at curbing the importation of the virus. We even suspended international flights, and to a large extent, we succeeded in this objective. I'm sure you're all aware our mandatory quarantine has been one of the successes in terms of curbing this virus. However, due to the nature of human interaction, it was not possible to keep the virus from crossing the border. No country has been able to achieve this, and therefore the objective later transformed into combating the virus in our communities, because that is where transmission has been established. And to a large extent, we are succeeding in this objective. We would like to thank all our able surveillance teams and healthcare workers, as well as the multi-agency teams that have come forth to combat the virus within our communities. They have identified high-risk areas, and we've been able to share with you these high-risk areas in our daily briefings. And they've also aggressively undertook contact tracing, which is a key element in defeating the virus, and we've improved our testing capacities and treatment. These efforts have significantly contributed to the current flattening of the curve in the country. Now, fellow Kenyans, our porous borders are the ones that have become the latest high-risk areas in the transmission of the disease. And the borders are now our key area of focus. On Tuesday, we informed you of a technical team that was sent to Namanga border on a fact-finding mission. The objective of this team was to assess the situation and to recommend interventions, particularly for truck drivers who are now becoming another weak link in the fight against the virus. And in our daily updates, we have informed you of the cases that continue to come from our border points, particularly Namanga. Yesterday, as you're all aware, we recorded 47 new cases, 22 of them being Kenyans, while the remaining 23 were Tanzanian nationals. At another border point of Isbania, Migori County, we continue to witness emerging positive cases. The government is closely monitoring these developments and putting in place interventions. We are aware that many Kenyans have been voicing concerns regarding these emerging trends at our borders and the porosity at our borders. We wish to inform you, as members of the East African community, we are in constant discussion with member states on how best this matter can be handled for the safety and well-being of our communities. The National Emergency Response Committee is closely monitoring this situation and will be able to escalate any measures that would be required. We therefore wish to urge Kenyans to remain calm and to exercise patience as the government addresses this situation. We do appeal to our communities living within and around our border counties to actively exercise the Nyumba Kumi community policing. We should be vigilant, and we should report any suspicious individuals who may use panya routes to get into the country. Turning to our situation as pertains to the COVID-19 pandemic, 4 from Kajiado, 4 from Nairobi, 1 from Uasin Gishu. And therefore, this brings the total number of those who've tested positive in the country to 758. The positive cases are also spread out in the estates as follows. In Mombasa, Likoni has 5 cases, Mvita 4 cases, Jomvu 2 cases, and Nyali 1 case. And in Kajiado, 3 are from the Namanga border point and 1 from Loitoktok. And in Nairobi, 4 of the cases are distributed between Isili and Kibra, with each having 2, while Uasin Gishu has 1 case from Tarbo. Today, we have discharged 3 people from hospital, and this brings to number 284 the total number of recoveries from COVID-19. And we do thank our healthcare workers for this achievement. However, on a sad note, we have lost another 2 patients, both from Nairobi County, and this brings to 42 the total number of those who have so far lost their lives from the disease. And we would like to send our heartfelt condolences to the bereaved families and friends. As we conclude, we would take this opportunity to